Welcome to our special podcast on World Breastfeeding Week. I'm Dr. Dhathri, and today we have with us Dr. Smrithi D. Nayak, consultant in Obstetrics and Gynaecology, joining us to discuss this year's theme, Closing the Gap, Breastfeeding Support for All. Welcome, Dr. Smrithi.
Thank you so much, Dr. Dhathri. I'm really excited and very happy to be talking about this topic, which is extremely crucial.
Let's start with the basics. Why is breastfeeding so crucial for both mother and baby?
Right. So, to start off with, we know that breastfeeding is a very natural process. It is something that every woman who's gone through the journey of motherhood goes through. And we know that breastfeeding is extremely vital because breast milk is very essential for the newborn baby. It contains a good mix of all the nutrients that the baby requires for its growth and being healthy. It contains extremely important immunoglobulins, which help the baby fight infections when it has entered a new world and a new environment. On the other hand, for the mother also, it helps with better postpartum recovery. It reduces the risk of ovarian cancer and breast cancer, and it also helps in bonding and making the mother and the baby be a healthy unit.
So, ma'am, this year's theme focuses on closing the gap in breastfeeding support. What are some of the common barriers women face when it comes to breastfeeding?
Right. So, closing the gap in breastfeeding, this is a very important theme because I feel like there are a lot of women who struggle in the postpartum period. And as an obstetrician gynecologist, during the antenatal visits, we are actually not able to give them a very good idea about how to prepare themselves for breastfeeding. So, one of the most important barriers I feel when it comes to closing the gap is the lack of information, right? So, patients should be told from before they deliver itself how to start prepping themselves for breastfeeding. Also, there's a lack of support sometimes from the community as well as the family. So, this leads to a lot of stress in the woman who is dealing with all of these problems all by herself. So many women also face problems like difficulty in latching, understanding how frequently to breastfeed, what is the time duration. And the most common question I face is the mothers feel their breast milk supply is inadequate and they are not enough for providing nutrition to the baby. That makes them start feeling guilty. And a lot of people in the family, unfortunately, have a lot of advice to give and extra comments where they tell the mother, you're not producing enough milk, which puts more pressure and stress on the woman. So, this is the gap I feel we need to bridge. As clinicians, we need to give out more information to these women who may struggle after the delivery because they're not prepared enough for that phase. So we just talked about bridging the gap, right? So Dr. Datri, can you tell me how can the healthcare providers that we have in our hospital help these women to bridge the gap?
Yes, Dr. Smriti. We healthcare providers can help these women in breastfeeding by offering prenatal checkup to the women, giving them knowledge in the antenatal period itself regarding breastfeeding. Also, after delivery, we can give them good emotional and moral support for breastfeeding, and also offer follow-up consultations after in the postnatal period. And we also have to train our healthcare staff, nurses, and sisters for lactation and breastfeeding health for the mothers.
Correct. So it's very important to remove the stigma. A lot of women are scared to approach us because they think, okay, breastfeeding is only going to happen after the delivery. But I want to put it out there that women who are pregnant can start prepping themselves and understand what the journey is going to be like after the delivery from when they conceive itself. There's no harm in prepping yourself and equipping yourself with the knowledge, which will really be a boon later on.
So, Dr. Smriti, what does community and family have to do and help in the women who are breastfeeding? How can they help the mothers?
Yeah, very good question. So I feel this is where actually the huge difference is made. The family plays a very, very important role, especially the spouse, because his role when it comes to the woman breastfeeding by giving emotional support, by letting the woman just breastfeed and then taking care of the other household chores and not really stressing her out about taking care of everything related to the household. It really goes a long way because the woman can totally relax. She can focus only on increasing the secretions, just focusing on breastfeeding the baby. The rest of the family members can definitely support by not criticizing if the amount of secretion is less, and just giving that moral support that the woman needs, because we know that everything takes time. So with time and the right advice, the woman also gets used to what it is like to breastfeed. For the woman, she's a new mom, the baby is again new, so they're all going through this journey where a lot of things are unknown. So honestly, putting a lot of pressure and comparing to other women, I've heard patients cry to me saying that their relatives compare to some other patient who's had a lot of secretions and you are not getting much milk. So these are all things which really put them down. So families have to be at least supportive, if not, be on the negative side. Other than that, when it comes to communities, they can empower women by encouraging to have baby friendly spaces, to have nursing stations where a lactating woman can go breastfeed. And also they can create peer groups where a discussion can be started about what all problems new moms encounter and how each one actually dealt with each problem. And they can discuss and not feel alone in this phase where a lot of things are new to you, and you feel very comfortable when you know the other person is also struggling with the same problem. So that way, communities can help breastfeeding women to overcome their issues. So moving on to workplace support, Dr. Dhathri, how do you think a workplace can help their employees and equip them so that they are more encouraged to breastfeed?
Yes, Dr. Smriti, workplaces can definitely play an important role in this aspect. Mothers usually would like to have a paid maternity leave, flexible working hours, and also designated lactation rooms for the same. And we should also have policies that support breastfeeding and lactation to these mothers so that they are knowledgeable regarding the same.
Correct. So to add to that, designated lactation rooms really help because a lot of working women actually end up pumping the milk out and they send over the milk to the baby who's at home. So it's not always necessary that you have to miss work and go back rushing home to breastfeed. You can always use pumps, and that also helps to continue the journey of breastfeeding. And again, I get asked, a lot of people ask this question as to how long should you breastfeed? So, a minimum of 6 months is always necessary for every baby. Beyond that, if you can even go up to 1 year and still continue to breastfeed, there's nothing like it. I've had some patients who have even breastfed till even 2 to 3 years, and that is also nothing wrong. Okay, but minimum of 6 months is for sure. Beyond that, it all depends on the woman and the support that she gets from her family.
So, Dr. Smriti, how can we take in technology and how can it be leveraged to encourage breastfeeding in mothers?
Correct. So, technology can be a great tool. And there are a lot of apps which help in tracking your breastfeeding times. They also give you tips and tricks to get more milk secretions. And I always feel that the source of information should be authentic and backed by science. So there are many WhatsApp groups that circulate which encourage people to join. But I would always suggest to make sure that the admin of the group is either a lactation consultant or a childbirth educator who will supervise the conversation in these support groups so that the right information goes across and not just hearsay. Apart from this, I think technology can also help with telehealth consultations, where patients, even in remote areas or tier 2 and tier 3 cities, can access the lactation consultants back in the major cities to get tips again on breastfeeding. So, in these ways, technology can be a big boon for women who are having problems with breastfeeding. Dr. Dhatri, what message to sum it all up would you like to share at the end of this talk?
So, I would like to encourage all the mothers to take in all the support that they need from their family and workplace and never give up on breastfeeding. Even though it's a very challenging task, we know that the benefits for both mother and the baby are immense.
Exactly. So, together we can close this gap. And I'd like to encourage all the women out there to take the support that we at Aster RV give for all the pregnant women We have a very good antenatal education program. We conduct regular sessions. We have many trained staff nurses who are lactation trained, and they are there at every point in the time that you get admitted during your delivery to help with your queries. We also have childbirth educators who also give inputs on breastfeeding. So, the challenges of breastfeeding should not hamper your journey into this breastfeeding. So, together at Aster RV, we can close this gap and support all the mothers to successfully breastfeed.
Thank you, Dr. Smriti, for giving in such wonderful insights regarding this important topic.
Thank you, Dr. Dhathri. It's been a pleasure to discuss such an important topic with you.
Happy
Happy
World
World
Breastfeeding
Breastfeeding
Week.
Week.